So, hello everyone. My name is Carlene Joseph. I am a nurse practitioner. I'm here to teach you how to do an intramuscular injection. So, if it's your first time coming on the channel, go ahead and subscribe and like the video and share it. I like to do things really simple because there's a lot of people that are not into the medical field, but actually have to do this for maybe a family member or themselves, depending on the situation. So that's what I'm going to teach you today. You know that you can do an intramuscular injection anywhere. You can do the deltoid, Vastus, Lateralis, what we're going to do today. The gluteal, you can do that as well. However, when you're doing it for yourself, it's much easier to do it on your Vastus Lateralis, which is your lateral side of your thigh. Okay, that is the easiest route. You know that intramuscular meaning it going in the muscle, not the subcutaneous, which is the sub-Q injection that goes in the fat, where you also have intravenous, which goes into the vein. They work different time and different rate at different speed. The intravenous is immediate, okay? And the intramuscular, you start to feel it within 15 to 30 minutes, right? But it's delivered directly into the muscle, whereas others delivered into the vein. So first we're gonna go over supplies that we're gonna need to do this injection. You never, ever use the same needle that you would draw the medication with to inject yourself. No. You use a blunt needle to pull out the medication, discard that needle, and then you screw on the needle that you actually want to use to inject yourself. So you will need a syringe. Today we're gonna use a 3 ml syringe, right? Because in the muscle, you can only go up to 3 mLs. You cannot go more than that, okay? You can go less. You can go 1, 2, but 3 is the maximum because it's a lot. The amount is a lot, and you don't want that much fluid in your muscle. So you're gonna use the 3 ml syringe, okay? We're going to use a blunt needle, right? That's the needle I told you that once you withdraw the medication with, you have to discard it. You cannot use it for injecting yourself, right? This is only to withdraw the medication, right? You're going to need some alcohol pads or one, just to clean the area, to make sure, one, you clean the medication top with, and the other one, you clean the area that you're going to inject, okay? And some gauze, just whatever, just in case. You don't have to have it, right? It's just in case. Now, today I have 2 needle size because that's gonna depend on your weight, okay? I have the 23 gauge and I have the 21 gauge. Don't think, okay, 21 is smaller. No, the smaller the number, the bigger is the size of the needle, right? So even if you hear that it says 21, it's actually bigger. So if you have, if you're a heavier set, or if you're a lot smaller, or you can even go smaller depending on how small you are. But I'm a big girl, so I am going to use the 23, which is the blue one. So I have. And then you always have your little sharp container because you cannot throw your your needles in your trash. That's a big no-no, okay? So your sharp container, and you have your gloves, okay? And then if you're giving it to yourself, you don't really need this, But if you're giving to someone else, that's different because once you wash your hands, you're fine. You don't actually have to have the gloves. So, however, gloves if you're giving it to an individual. So what we're going to do first, we're going to connect our needle to we're going to connect our syringe to our blunt needle because we're going to withdraw the medication. Of course, you do your hand hygiene first. I cannot express your hand hygiene. wash your hands, hand hygiene. Since I'm doing the video, so I'm just telling you, walking you through it. Hand hygiene, I already did my hand hygiene before coming to do your video, to do the video. So hand hygiene first, right? And then you open your syringe and you open your needle. It's very easy, just pull open. You screw on. You see, you just screw it on. The needle. Remember the blunt needle. This is to just withdraw the medication, not to inject yourself. Absolutely not. Okay. So now, once you do that, you come out, you see this is the needle. You wipe off your medication. Today I'm gonna do the glutathione. Glutathione, it's like an antioxidant, helps with liver cleansing and anti-cancerous. It helps with a lot of different things, your skin, your memory. It helps with a lot of stuff. So this is what I'm going to do today. And you can use up to 3 ml of this in your intramuscular. But today I'm just going to do like 1 or 2. Okay, so you clean off your medication. It can be any medication, but this is what I'm using today. It's one of a supplement, but you can use anything. It can be a B12, right? A vitamin B12 injection. It can be something else, right? So you wipe your cover. You wipe your cover. And remember when we started, we did our hand hygiene, right? So you insert your needle directly down into the plastic top. All medication, when they're brand new, there's a little cover clip. You just pop it off, right? And if you get it something, it's not on there, bring it back to the pharmacy. It has to be brand new. Of course, this was mine, and I do have an IV hydration company, so I use this frequently. So this is why it's open. So I wiped it, insert the needle, and I am going to withdraw the medication. So a little trick, it's very easy to withdraw when you flip it, right? And always make sure that your needle is actually sitting in the fluid. If it's over and the fluid is it's underneath, you won't be able to withdraw it because the hole needs to be in the fluid, so that way you can have the suction to withdraw. So I am going to flip. You flip, right? And you make sure that your needle is in the fluid. So you pull out, and remember, you just pull on your syringe, right? And a little trick is that you're using your thumb to pull while your index finger is holding the syringe right here. Okay, so remember I'm doing 2 ml because you can, like I said, you can go up to 3, but today I'm doing 2. Right? And if you feel like you got any air, just go ahead and push it back, right? You can go ahead and just push it back into the bottle. You push back your air. So this is my 2, and I'm done, right? This is my 2, right? Remember, I told you it can be any medication, but today I'm doing the glutathione. I'll do a little more in-depth video on this. So remember, we're just doing the intramuscular injection today. That's why that. So however, but it's a very, 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 very effective supplement to do. And it actually cleanses your liver to the max, right? And also help with insulin resistance. It also helps with your skin. A lot of stuff. It helps with a lot of stuff, right? So long story, you insert back to take off the needle. You take it off and you put into your sharps. Remember, I'm gonna use the 23. So, okay, you see how I screwed it off? Okay, so now this one opens up and you screw it on as well. Like you screw it on a bottle top, you have to make sure it's screwed on, right? Make sure there's no medication in your needle, right? Because as you insert to go to your muscle, you have to make sure there's no medication there, right? And just to make sure, when you do that, you pull back a little bit once you insert. So now let's go into the injection itself. So, okay, you put just needle down, take your other alcohol, and you're going to wipe the area. Okay, Remember we told you we're doing the vastus lateralis, where that's your thigh, right? You're going to imagine, look at yourself, okay? Deltoid is your shoulder. We're not doing that. If you're doing it for someone else, then that's fine. But when you're doing it for yourself, it's kind of hard to, however, it's easier with your thighs. So you imagine yourself, you're not going directly to the front, okay? So imagine right here, you're not going to the front. That's why it says lateralis. That means towards the side. So you're going to imagine your side, right? And then you're going to use your finger to find your bone right here, your hip, okay? And then from there, you imagine your palm. In the middle of where your palm lands is where you inject. So in other words, you're not going to go all the way down your thigh, or you're not going to come all the way up your thigh, right? And you're not going to go to the middle so you don't mess with your bone, right? Because, you're famous, you don't want to mess with your bone either. So imagine to the side, right? You feel for your bone here, and then put your palm down. And in the middle of your palm, it's like right here, and that's where you're going to go. That's where you have the thickest muscle. Okay, so we're going to do the vastus lateralis. So here we go. We wipe the area, right? This was where my palm ended. You wipe the area as nice as you can, right? Wipe the area. If you're doing it for a patient, it is much easier if they're laying down. But now I'm teaching you for yourself, right? You take out your needle. It always has a cover until you're ready to use it, okay? You take out your needle, and then you take out your cover. See, it's not that big of a needle. Some people like to squeeze the thigh. I don't like to do that because you're actually wanting to get into the muscle. So you want to space out the skin if possible, to me. Most people, it depends on how you feel. You may feel a different way, but to me, this is how I think it's best, because you're trying to get into the muscle, not the fat. Because when you squeeze, you're showing the fat. You're pronouncing the fat itself. So you extend the area, right? And remember, we wiped with our alcohol. You're going to at a 90-degree angle, not 45, not 30, but a 90. So you're going directly in, not 45, not 30, right? Not 75, 90. Think of your arm when you're doing a 90-degree. It's like like when you're playing the little dot, right? So think that you're playing that little game where you throw the dot. So 90-degree aiming. So you clean your area, right? And then you 90-degree aim, right? And you're going to insert 90-degree. You're going now, right? And all the way. It has to reach all the way. And then once you're in all the way, you pull back just to make sure there's no air. There's no blood, not air. There's no blood, right? Once there's no blood, then you inject. Now, you are not going to push fast. No, you're going to go because it's going in the muscle. You have to give it time. And depending on the medication, so as I'm talking to you, I'm pushing. Depending on the medication, it may burn, okay? Depending on the medication, it may burn. And you're not going to go too fast because you're delivering it to the muscle. So you got to go a little at a time, right? A little at a time. And if it helps you to sing happy birthday, or 1 Mississippi, 2 Mississippi, whatever is easy for you, you do that to help deliver the medication. You're not going to do it fast. Now, when you're done pushing, do not pull out really, really fast. You want to get that burn feeling. You wait, let it sit there for a quick second, and then you pull out, right? You pull out, and you lock your needle. Now, some people have a little blood and others don't. It all depends. And depending on the medication, you might want to rub it, just to massage it, just to move the medication around. Some has little lumps, some has nothing. So see, you just rub it around. If you do, you do. If you don't, you don't. Some people don't, right? And most times you're not even supposed to have blood because you're not going into the vein, right? And you're done. That's it. A breeze. That wasn't hard, was it? And like I said, if you're doing it for a patient, it's best laying down because you have better access, right? But if you're doing it for yourself, you would want to stand up so you can actually see what you're doing, right? And I always suggest that, of course you're going to rotate your area because if it's something that you do frequently, you're going to rotate your area. But if it's in a blue moon, it's best to use your right because you have more control. You see what I mean? As opposed to trying to, reach over. So remember, do this. You don't want the middle laterals. You want the sides, right? And when you do the sides, you feel for your bone, right? And then you put your palm down. In the middle of the palm is where you have the most muscle, well, the biggest muscles. So here, and you go ahead, wipe your area. And before you do whatsoever, wash your hands, clean hands, keep the germs away. Gather your supplies, right? If you're doing it for someone, make sure you have gloves. And if you have a sharp container at all times, right? And always make sure your medication has the seal cover on it. If it's a first time use from pharmacy, it doesn't have it, bring it back, ask for one. Some of the IM injections are pre-filled and you don't even have to do all of that. But if it's not, then remember the blunt needle is to withdraw, okay? And the injection needle itself is you never ever use the same needle to inject yourself. One is to withdraw the medication, one is to inject. Remember that, okay? Never go and try to insert a blunt needle into your body. And most of the needles nowadays, they all come with this safety cover, with the safety cap. So once you're done, you just pop. It pops right in. And then you drop it into your sharp container. Okay? Always have your sharp container. You drop it into your sharp container. Okay, so if you feel like this video actually helped, go ahead and share it, like, subscribe, and I'll see you later. And if you think of anything you would want me to talk about, because I like to talk in simple terms, because I know a lot of people are watching that are not like in the medical field or that are in school or so on. So if you want me to talk or teach something else, go ahead, let me know, and I will gladly go into that, okay? Thank you.